Hi everybody, I hope everyone's having a good afternoon. So today I'm going to take a little bit of your time to talk to you guys about insomnia and how it can affect your life. How many people here have had at one time in their life trouble going to sleep? Right? It's a common problem. A lot of people have experienced that. So according to the article, Assessing Insomnia Management in Community Pharmacy Setting in Jordan, a stimulated patient approach. Insomnia is a sleep disorder in which 30% of the world population suffer from, right? So if you suffer from this, don't worry about it. You're not the only one. 30% of our population go through this. There are different types of insomnia. One type is chronic insomnia, which is a little more serious. This one can last from weeks to even months. This is usually caused by medical conditions, sleep disorders, or some other underlying cause like side effects of a medication. Acute insomnia, which usually lasts a couple of days or weeks, is usually brought on by stressful situation, whether it's your home life, your school life, your work life, and also your lifestyle, the way you're living now, right? What can cause insomnia? So there are many underlying causes that can lead you to having insomnia, right? I'm going to give you guys just a few so you get a better understanding. The more not so serious causes could be your eating habits, your sleep schedule, travel or work schedule, and stress, right? So what I mean by that is if you have a Starbucks at 5 in the afternoon and then you expect to go to sleep at 10, you probably won't because you have so much caffeine in your system, right? So that could be, or maybe if you're taking a lot of naps throughout the day, at night, you're not going to want to go to sleep, right? So those are some lifestyle changes that you can do to help you with that insomnia. The more serious reasons why you can have insomnia is could be due to medical conditions, caffeine or nicotine, medications, mental health disorders, and sleep-related disorders. So some mental health disorders could be like PTSD, right? People from the Army tend to suffer from that, and insomnia because they can't go to sleep because of the post-traumatic stress disorder, right? They have very bad dreams, flashbacks, and so in turn they're not able to go to sleep. Some sleep-related disorders could be sleep apnea, which means that during the night when you're asleep, you stop breathing for certain periods of time, right? So it interrupts your sleep. Why insomnia needs to be treated? So insomnia should not be a thing to take taken lightly, right? It can cause some serious repercussions if not treated at the right time and early, right? Some repercussions that can happen are like fatigue, mood swings, lack of motivation, which can then cause you to lose your job, cause you for your grades to slip, right? Because if you're not sleeping, you don't have the motivation to study. If you don't have the motivation to study, you're not going to pass that test, right? If you don't pass the test, you're not going to pass the class, right? So it has repercussions that can affect your everyday life. And once it starts affecting your everyday life, it is very important that you go see someone about this to help you. Diagnosis and treatment. So I am not a doctor, so even though I give you guys some tips and everything, what you guys, the most important step is to go see a physician so they can help you, so they can diagnose it and treat it, right? So the first thing is that the physician is going to ask you the questions that are going to be tedious, right? How's your sleeping schedule? What medications are you on? All the things to try to get a proper diagnosis as to why you're having sleeping problems and insomnia. Once that's done, your doctor can figure out if treatment can be as simple as changing your lifestyle habits, or if it's more serious and you need to visit a sleep center. And at a sleep center, they're going to check your brain wavelengths, see if you have things like sleep apnea, right? And then the way to treat these things are through therapy. Changing your lifestyle is a big one. No more naps, no more caffeine. One form of therapy that has been very useful is music. People use music to try and help with insomnia because music not only helps you treat insomnia but also helps you with depression, which is a side effect of having insomnia. So it's very helpful. Also, another form of treatment is that you only use the bed to go to sleep. So if you're having trouble sleeping, then you go to bed, you stay in bed for 15 minutes, and then after 15 minutes you haven't gone to sleep, leave, and then come back. That's another form of treatment, therapy that they use. In conclusion, Insomnia is a serious disorder and should be treated immediately. Whether it's chronic or acute measures should be taken. I want to thank you all for listening, and I hope you all were able to gain a better understanding of what insomnia is. Thank you.